Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Atp Hour. I am Gbemisola Boyede. I'm a pediatrician, and it's my pleasure to be with you on today's broadcast or podcast, or whichever platform you're watching us. Thank you so much for joining us. Atp Hour is a program where we tend to talk about important topics that affect the health of our children. Because on Ask the Pediatricians Foundation, our goal is to make sure that no child dies from preventable causes of death. And we do that through our program online and offline. And this program you're listening to now is one of our online platforms where we talk about health issues that affect our children. So whether you're watching me on Facebook or on YouTube, or you're listening to me on Fresh Waves Radio or the podcast, I want to say thank you so much for joining us today. And for the past couple of months, I've been looking at the vaccine preventable diseases. We've looked at polio, we've looked at tuberculosis, we've looked at cervical cancer and human papilloma virus. And last week, we also talked about rotavirus and diarrhea. And today, I'm going to talk about another yet important vaccine preventable disease, and that is chickenpox. And a lot of mothers have been asking me to talk about chickenpox because it's something that most mothers are familiar with, and it's one of those conditions that mothers tend to diagnose. I said that measles or chickenpox or itch rashes. Those are the three most popular diagnosis that mothers like to give rashes. So I think it's befitting that we should also talk about chickenpox. But more importantly, do you know that chickenpox is also one of those vaccine preventable diseases? Yes, chickenpox is one of them. Unfortunately, chickenpox is one of those vaccines for those of us in Nigeria who that is not yet part of our national program on immunization. So it means you have to pay for it if you are going to get the chickenpox vaccine. But at least it's important for us to know that it is available, and if you have, you can pay for it, and that will protect your children against chickenpox. So we're going to talk about chickenpox today, but just to remind you again, if you have any questions about this topic or any other topic that we talk about on these programs, you are welcome to post them to our Ask the Pediatricians Facebook group from Mondays to Saturdays, and we'll be there to answer your questions. Remember that if you want to support of any of our outreaches, currently we're doing the first aid care project, and we have been to several schools all over the country sharing these are our first aid care tips. I don't know whether you can see it. Yes. And giving all our children, talking to them about first aid, and also giving them this first aid care reminder booklet so that they can have it in their pocket to remind them what to do in case of medical emergencies. And we also give the schools the bigger version of it as well, that they can have it on the decks of the teacher, the principal, so that they can always quickly use it as a reference point when there's an emergency to know what to do. So if you want to be part of that project and you want to support us, see the details of our account details. We would like to be part of it, and this is something we're going to continue even in 2024. Feel free to post on our feel free to send your support to us, and of course feel free to reach us via email or on our WhatsApp number if you'd like us to be a partner with you in doing this project and in reaching many more students. And of course the materials are also available online and you can download them. If you need the link, just reach out to us and we'll send them to you as well. So thank you so much for all of you that have been part of that project, either as volunteers, as donors, or you have also done the online version of it yourself. Thank you so much for being part of it. So thank you so much for allowing me to do that brief announcement. Now I'm going to go on and talk about what we're going to talk about today. And we're talking about chickenpox. So as usual, I'm just going to use my outline. We're going to talk about introduction, what is chickenpox, and then we look at what are the signs and symptoms of chickenpox. How do you know when a child has chickenpox? And then we look about why is it important to talk about chickenpox, what are the complications that you can have in chickenpox, and then how do we treat chickenpox, and then how do we prevent chickenpox. Of course, I already answered that by telling you that chickenpox is one of the vaccine preventable diseases. Okay, just to start by saying another name for chickenpox is varicella. So some of you may be familiar, you may see the vaccine being called varicella vaccine or VZV vaccine. So just for you to know that varicella zoster is the medical jargon name for chickenpox, but I think I will just stick to what most of us are familiar with and just talk about chickenpox. Okay, so chickenpox is one of those conditions we call viral exanthem. In other words, they are conditions that are caused by viruses, and then they tend to come with fever and then with rashes. So we call them viral exanthem. So a child will have fever and then we have rashes. Another example is measles. Okay, another example is the German measles or rubella. So, and those conditions that come with a fever, and then some subsequent down the line the child will have rashes. Another popular one is mumps, so maybe I'll talk about mumps subsequently next week. So these are all conditions that are due to viruses, but what's make them unique from all those other conditions we are familiar with is that the child will have fever and then we will have rashes, but the way the rashes look are different. Another thing we need to know is that these conditions, like chickenpox, is very contagious. In other words, when one child has it, most people around that particular child will likely have it as well. So a lot of mothers come to our Facebook group and they're like, oh, my child already had chickenpox. How do I protect myself? How do I protect my other children from it? I'm like, oh, it's already too late, because by the time your child, by the time you are seeing the rashes and you're telling us this child has chickenpox, all the children that have come in contact with that child have already been exposed to it, okay? And most likely, it's too late at that time to protect them. The best thing is to protect them much, much earlier before they are even exposed at all to somebody who has chickenpox, which is what I'll be telling you much more about when we talk about prevention of chickenpox. So chickenpox is very contagious. It is caused by the virus called varicella zoster virus. That is why the other name for chickenpox is varicella or varicella zoster, because that is the name of the virus that causes chickenpox. We call it varicella zoster virus, and it tends to cause this kind of very itchy rash. You know, that's one of the unique thing about chickenpox is a rash that is very itchy and tends to look like blister, kind of rashes. I think most people tend to recognize the picture. I'll show us a little bit of picture for those who are watching, and for those who are listening, you can just let your imagination run, or maybe after the program you can just check out the video or look out for pictures of chickenpox rashes on our Facebook group as well. So the chickenpox rashes tend to look like blister, a little bit bigger than each rashes, but it's very itchy. And then those rashes go through different stages. It initially may look like it's just something hard, then it may look like something that looks like water, then it may look like something that have busted, like a small wound, and then it will dry up. So it can be in different phases, but it's usually very blister-like and very, very itchy, and it's so contagious. And the rashes in chickenpox tend to appear on the chest. So if you remember when we're talking about measles, for those of you who are very consistent in listening to us, I told you that the measles rash tends to start from the hairline, around, in the face, in the head. So it starts from the hairline, and then it will spread down on like chickenpox rash. Chickenpox rash tends to happen around the trunk first. So it starts around the chest, the back, and then before it will spread to the rest of the body. So that is a little bit of difference. And of course, the measles rash is also a little bit different from chickenpox rash. So chickenpox is one of the viral eggs that comes with fever. Then you also have that unique kind of rashes that you tend to see in chickenpox that tends to start on the trunk, the chest, the back, before it will spread to the rest of the body. And it is very itchy. And like we said, chickenpox is caused by varicella zoster virus, and it is very, very contagious kind of viral infection. And why is it important for us to talk about chickenpox? Because chickenpox, people just think it's one of those things as if it's just something you can have. Luckily, yes, most children will have chickenpox, they have the fever, the rashes, and that's it. Nothing else will come out of it. But sometimes in certain category of people, chickenpox can be quite dangerous. Yes, chickenpox can be something much more serious in certain group of people, especially pregnant women. Okay, so sometimes I see people asking me a question and they're pregnant and they're having somebody who is having chickenpox, and they are kind of like, it's not a big deal. It's a big deal when a pregnant woman has chickenpox, okay? Because that baby is at risk. It's a serious one. It's also a very serious risk when chickenpox affects very small babies, and also people who have what we call weakened immune system. People who have for one reason or the other, the immune system is not functioning optimally. So people who have HIV, for example, people who have tuberculosis, malnutrition, or people who are on steroids or cancer drugs, they already have what we call reduced immune function or immunocompromised, or the immune system is really compromised already, and such people are not able to fight infection. So if such people have chickenpox, it is really, really something very, very serious for them. And that is why it is important for us to talk about chickenpox. So it may look like it's not one of a big deal thing, but for certain group of people, the very young babies, pregnant women, people who have immune compromised situation or immunosuppressed situation, they are the one that can have very severe kind of chickenpox that can actually lead to death sometimes. So it can look as simple, but it can also be fatal. And so it is not something we should joke about. So anybody who has not had chickenpox or who have not had the chickenpox vaccine can have chickenpox. So chickenpox, even though I'm talking as a pediatrician, it's not just only children that can have chickenpox, okay? Adults also can have chickenpox if they've never had it before, and usually can last. Chickenpox usually lasts about a week. So from the rash to the rash clearing, it can take 4 to 7 days. So what are the symptoms? What are the signs that you will see in somebody who have chickenpox? Now, most of us are familiar with the rash. That is what we always see. When we see the rash, then we say, oh, it is chickenpox rash. But before the rash, there are certain symptoms that will precede the chickenpox rash itself. So, and unfortunately, at the time the child is having those other symptoms, most of us are not even thinking chickenpox, okay? Unfortunately, that is the time that they are already exposing and getting other people who are around them infected, even when they don't know it. So like I said, chickenpox is one of those viral enzymes. So they usually start with fever. So usually before the child have the rash, few days, maybe few days, a couple of days before the rash that will make us to know it's chickenpox come out, the child would have had other symptoms, usually fever, they may be tired, they may have poor appetite, they have headache. And if you are in Nigeria, when somebody has this kind of symptom, fever, poor appetite, headaches, tiredness, what do we think? We just think, oh, it's malaria. Okay, so most people always think they have malaria, and sometimes mothers will even start treating the children with anti-malaria straight away, which is why we've been advocating that you don't just go treat every child who has fever with anti-malaria, because chickenpox can start like that as well, and it is no malaria, and there's no reason for us to put these children on unnecessary anti-malaria medication. So a couple of days before you see the rash, the child would have had fever, loss of appetite, tiredness, and all that. And after that, they will now have the rash. And usually the rash will come out one or two. You'll see it on the chest, on the back, and then before you know it, it will be spreading all over. And I've described the rashes for us. The rash is usually very, very itchy. The child is scratching and scratching their body, and it usually comes first like something that look like a raised part, something that you can just see, and then later you can feel it, and then it's become like something that has a little bit of water, like a blister or a cyst, and then before it will now turn as if there's a wound that is healing, before it will now completely removed, peel off the body. So that is how chickenpox is. And let me just show us a few pictures of chickenpox I managed to get online. So this is a picture of chickenpox rash. Apologies to those who are listening to me, but for those who are watching, you can see this picture. And if you look at it, you see that the rashes, they are all in different stages. If you look very well, you will see those that are just like some changes in the color on the skin. Then you will see those that look like a typical blister, like if there's water inside. And then you will see those that are already healing like a scab, as if it is a wound. So the kind of rashes we have in chickenpox, at every point in time, they are all at different stages. So that is how chickenpox will look like in a dark skinned child. And this is another look in a child with a fair-skinned child. So, but I think most of us are quite familiar with chickenpox, and so but if you're not sure, please, if you see a child who had fever and all that, then start having rashes and it's more on the chest, the back, and they're all looking different, then you can suspect or let a doctor have a look, and so that they can confirm whether their child truly has chickenpox. But the rashes are quite distinct and quite easy for most of our doctors to know. So it's one of those conditions that we don't need to do a blood test to confirm that this is chickenpox. We get the history correctly in a child who has not been immunized with that fever for a couple of days and now came down with this blister, very itchy rashes. We are very sure that this is chickenpox. And of course, it's very contagious. So most people who have chickenpox will not be able to the children will not be able to go to school. Usually the school will tell them to stay home. So most children will end up losing almost 1 week of school because of chickenpox. And sometimes it's still possible, because this is one question people ask all the time, that my child was immunized and the child still has chickenpox. It is still possible, but even when, like we said, immunization is not always 100%. It's really help, but it's not always 100%. But if your child will now even have chickenpox in a child who has been immunized, it's going to be very mild, very, very mild. It won't be as severe. You may just have a little bit of spots and maybe even no fever, and then very short duration, and then the child is well. So it is not as serious like those who have never been immunized at all. Okay, so that is signs and symptoms of chickenpox, and like I said, it's one of those conditions that is very easy to diagnose, and once we see it, we know it. We don't tend to need to do blood tests. However, some people can have very severe form of chickenpox. So apart from the fever, the weakness, tiredness, and the rashes, there are some other serious complications some other people can have as a result of chickenpox. Okay, so which is the one that worries us, especially in a particular category of people. So we've talked about most healthy people who have chickenpox, they are fine. You have the rashes, you eat you 1 week max, you're back. But complications can happen in people who have other issues. Number one, whether who are not healthy, who are immunocompromised, or because of their age, so they are at risk of severe complications. So babies, infants less than 1 year old, pregnant women especially, and people who have lowered immunity, like I mentioned, people with HIV, AIDS, or cancer, people who have had transplants, who are on chemotherapy, who are on steroids or medications to suppress their immune system. Those people can have very serious complications with if they have chickenpox. And what are the complications they can have? They can have infection that we call secondary infection. So the child already have chickenpox, which is a viral kind of infection. It's caused by a virus, but because their immune system is now further suppressed, it is easier for other infections to come in as a secondary infection, like bacterial infections of the skin from what we call the group A streptococcal infection. Such people can also have pneumonia, very serious pneumonia, which is infection in the lungs. They can also have infection in the brain. So this chickenpox can get to the brain and cause what we call encephalitis, and they will have brain kind of neurological problems. They can also have bleeding problems. They start losing blood as if in Ebola or Lassa fever. You can have that kind of scenario from chickenpox as well in people who have the complicated form of the chickenpox. They can also have sepsis, which is when there's a lot of infection going on in the bloodstream and affecting multiple organs. So people who have complication from chickenpox because of the other issues that they have, they can become so sick, and they will need to go to the hospital, and some may even die, though it is not as common these days, thank God, because we have a vaccine that can protect us. But this, like I said, this severe form of disease or complications are not in most people. Most children, elder children, will not have this, but those who are at risk, the pregnant women, the infant, the immunocompromised people, they are the one that can have these serious kind of complications. But majority will just have the fever and the rashes and no other issues. Now, the question is, how do you get chickenpox? Like I said at the introductory part, it is a very contagious disease. It's something that's most people, it spreads so easily. Okay, it spreads so easily. In fact, it said that if one person has chickenpox, 90% of the people in the family or close to that person are going to have it. And I'm sure we're all familiar. I remember one instance when one of my kids had one child in his class had chickenpox. Virtually all the children in that class had chickenpox. So it was just 1 week everybody would have to go. They were just going out in batches. So it's something that is very, very contagious. So and it's usually spread from close contact. So once somebody has it, you come close to the person, you don't need to use anything they have used, or it's not like COVID that you have to sneeze or cough and all that. But just coming in contact with that person is almost it's almost guaranteed that the other person will have chickenpox. And even in the past, some parents actually deliberately do what they call chickenpox parties. In other words, they deliberately expose their children, to people who have chickenpox so that they will have chickenpox, and they think that way those children will be protected against chickenpox. Actually, the CDC, and many other organizations, we kind of discourages those kind of practice. We don't want you to host chickenpox parties or participate in it. We'll rather recommend that you take your children for vaccination, because like we said, some people can have very severe kind of chickenpox and they can have serious complications and die. And sometimes you may not know that there's a child who is on steroids or who is immunocompromised, who is incubating maybe cancer or something, and then they go for such parties and they have the severe form of chickenpox disease and they can die. So we don't want you to go for chickenpox parties or any of or host or participate. Rather, we recommend that you just go for immunization, because there's no way we're going to predict which child is going to have the severe form of the chickenpox or not. So don't take a chance. Don't take your children for chickenpox parties. Please take them for the immunization instead. Now, like we said, chickenpox is transmitted from person to person, and the challenge here is that chickenpox, the person who is going to have chickenpox is already transmitting it even before they know they have chickenpox. So a couple of days, as at the time what we call the incubation period, when the person is still, having mild symptoms but not yet the rashes, they are already able to infect people 1 to 2 days before. So and you are even after the rashes have all cleared, the person can still infect people. So most time, by the time parents are coming to us and say, my baby has chickenpox, how do I prevent the others? It's already too late. The others have been exposed already. They've already been exposed before you see the rashes in the other person. So the best option is to make sure that everybody is immunized, and even up to 24 hours until no more new rashes coming up, the person is still can still infect or is still contagious and can still infect other people. So, and after the person after you've had chickenpox, the virus kind of stay in the body, and sometimes in future as adults it can reactivate as what we call shingles. Adults tend to have that, so it is something that can happen as well. So sometimes after you've been exposed to chickenpox, you don't necessarily have to have chickenpox immediately. It may take up to 2 weeks. So sometimes some people don't remember. They were like, oh, I was not exposed to somebody who has chickenpox. It may have been somebody in your school, or it may have been somebody in her home, in church, anywhere, but you didn't stay long enough with them so to know whether they eventually have chickenpox, but you may have chickenpox 2 weeks after. So it is not always immediately that you're going to develop the chickenpox. It can take up to 2 weeks, what we call the incubation period, and you may not even remember, because remember, the person that may have transmitted to you may not have the rashes at that time, so you will not know that they are going to have chickenpox. And so that's why it's really something very contagious, and it can spread so quickly and so easily. All right, so let's talk about treatments for chickenpox. Okay, so chickenpox is, again, like most viruses, we don't really have any specific drugs that we normally have to give to people, though there are a few antiviral drugs, but most people don't really need any specific medication to treat chickenpox. What we normally do is to relieve symptoms. It's just it's something that, like we always say, will run the course, usually within 1 week, in elderly people without all those complications that I talked about earlier. The chickenpox rash is going to go away. They are going to be fine. So it's more of a symptomatic kind of treatment. We just want to make the person comfortable. Okay, so what do we do? So if they have fever, we give them paracetamol. So paracetamol, we take care of the fever, and we always recommend that you don't give please don't give aspirin or any aspirin containing drugs. In fact, for children generally, it's best to avoid aspirin or any aspirin containing products to relieve the fever, because there's a complication that can happen in children when they use aspirin. We call it Rice syndrome, and this Rice syndrome will cause severe liver failure. And so if your child has fever, whether it's from chickenpox, measles, or any other condition in children, because you are not always sure which one it is, please do not give them aspirin. Only give paracetamol. That is what you should give for the fever, okay? And of course, you can give a cool bath, you can give them, you can sponge them and all that, but paracetamol is good. Please don't give aspirin, so that we can avoid the child having Rice syndrome, which is a severe form of liver failure, and it can affect the brain, and it can be very fatal. It can lead to death. So we want to avoid that. So no aspirin, use only paracetamol. Okay, that is what you can do for the fever. For the itching, you can use calamine lotion. That is what most of us are familiar with, and I'm sure most of us have seen how the people who have chickenpox. I think that's what is very obvious most time when you first see them, is that they're all colored whites with the calamine lotion. So the calamine lotion is soothing. The calamine lotion is not like a drug, or it's not like a treatment for the rash. It is just to soothe. It makes the body, it gives the children a soothing effect against the itching of the rash. So you can do that. Some people also use baking soda or uncooked oatmeal, some of those things also help. Also make sure that their nails are short, because they have this tendency to itch, so you want to keep the fingernails short, so that will prevent scratching, and that will also prevent the spreading the rash the more. So those are the things we do, and just let them be and let them make sure they are eating, drinking lots of water, so that they are not dehydrated, and that is what we usually take care of chickenpox. And most people, like I said, within 1 week, they will be fine. Also, in terms of the fever, still, just to let us know that the American Academy of Pediatrics also discourages using ibuprofen, because it has also been treated with some other complications as well. So when it comes to fever in children, I think we are just best sticking with paracetamol as much as possible. All right. So, but when do you need to go to hospital for chickenpox? Okay, like I said, most chickenpox, give paracetamol for fever. Let them drink a lot of water. You can apply calamine lotion for soothing effect for the itching, and within 1 week, we expect everything to have cleared and the person will be fine. Of course, you have to keep them away from going to school so that they don't infect other children as well. But there are situations where you will need to take somebody who has chickenpox to the hospital. Again, that has to link up with what we talk about, those who are going to have complicated chickenpox. So anybody who is pregnant and has chickenpox need to go to the hospital. You need to see your doctors, because like I said, you are at risk of having complications for yourself and even for the baby. Also, those who have immunosuppressed condition, those who have HIV/AIDS or cancer or transplants or on steroids or other immunosuppressive drugs, please, if you develop chickenpox while you're on treatment or while you have any of this condition, you have to go to the hospital. One of the fear of those who do transplants and all that is make sure you don't develop any of these complications. So chickenpox is one of the worst diseases that somebody can develop where you have had a transplant or you are on immunosuppressive drugs, and it's very easy to have because it's something very contagious. So usually when people have those conditions, you want to keep them away from people that may have chickenpox so that they don't develop chickenpox, because if they develop chickenpox, it's serious. And it's very complicated. So, but if so, in that scenario, those people have to go to the hospital. So, because when the management is different, okay, it's very different. And also, if it's a baby less than 1 year old or all those other people, you need to go to the hospital. Apart from these high risk people, we need to go to the hospital if they have chickenpox. If there are other things you are noticing with chickenpox, like I said, most people should just have the fever, the rash, and then they should be fine. They should be eating well. They should be doing every other thing well. But if they have what look like chickenpox and they are not having fever that is going on for more than 4 days, they have to go to the hospital. Or the fever is so high, it's above like 39 or 40, they need to go to the hospital. Or the rash is, it's not bringing out pus, or it's causing all that what look like bacteria, chickenpox is viral kind of infection, but if you're not having what look like pus or something coming out from any part of the body, then that is complicated. That is not like a bacterial infection on top of the viral infection, and those people have to go to the hospital. Or if somebody who has chickenpox is acting confused, or they are like they have difficulty keeping awake or waking up, like they are becoming unconscious, or their level of consciousness is dropping. That is a complicated case that has to go to the hospital. If they have difficulty walking or they are staggering, that can be a sign of neurological problem, and you have to take them to the hospital. Or if they have stiff neck, like they can't bend their neck, because like I said, chickenpox sometimes can spread to the brain and cause what we call encephalitis, and they can have even problem meningitis and other meningoencephalitis. They can have infection affecting the lining of the brain or the brain matter itself. Such people is an hospital case. Or if they are vomiting and they are having difficulty with breathing, or they're having severe cough, severe abdominal pain, or they're having rashes and they are bleeding, they are bleeding so much under the skin, once you have any of these complications, please, that is no longer simple chickenpox that you can treat at home by yourself. That is a chickenpox, complicated one that has to go to the hospital. And when they get to the hospital, the doctors need what to do. And those are the ones that we tend to give the antiviral drugs. Sometimes even as injection, usually it's cyclovir. They'll have to give it into the blood, and those are the ones that get those kind of treatment. But most people who have the simple, straightforward chickenpox, they don't need a cyclovir, they don't need any antiviral drugs, and they don't need to go to the hospital. They just need to stay at home, take their paracetamol, take their use calamine lotion, and they'll be fine. So please, if you think something is chickenpox and you are beginning to see all these other things I've mentioned, loss of consciousness, fever that is very high, persistence, signs of neck stiffness, convulsion, the person is not able to walk, they are becoming drowsy, they are not easy to wake up, also start having any other issues, complications, please don't say, oh, it's just chickenpox. That time you have to take them to the hospital, and that is where the doctors will now treat them with the antiviral drugs, and hopefully most should recover as well. All right, so now let's go to the final part, which is how do we prevent chickenpox? Okay, like I said, chickenpox is preventable. It's one of the conditions that we have vaccines against. So we have what we call the varicella vaccine, and it is available even in Nigeria. I know it is not currently part of our national program on immunization. We are hoping we are going to expand our MPI vaccines. And like I always tell you, when I started ATP over 8 years ago, pneumococcal vaccine was not part of the national program on immunization, but now it is. Rotavirus was not part of the national program on immunization, but now it is. HPV has never been, but we are now getting the feelers that HPV is now going to be part of our national program. So hopefully down the line, chickenpox will also be part of our national program vaccines. But currently it is not, which means you have to pay for it by yourself. But it is available in some countries. It's available already, and it's part of the vaccines that is given free. But if you're in Nigeria, it is not yet free, but it is available at a small token. You can get it, and even in some of our government hospitals, they can get it for you, and they'll be able to give you. So there are 2 doses that you can get, and for this chickenpox vaccine, and it is very safe, it is effective, and most people who get the vaccine will not have chickenpox. So and like I said, even if, because in medicine we say never say never, even if they eventually have it, it's not going to be serious, it's going to be mild. So for those of you who are in private hospitals, who get your immunization from your private hospital, it's most likely most of them to give chickenpox vaccine. Some give it at age of 1 year, some give it at age of 2 years, depending on what schedule they are following. But usually it's given around the age of 1 year or thereabouts. So it is available. Please try and get the chickenpox vaccine. And once you have the chickenpox vaccine, your child will be protected against chickenpox. And if at all they have it, it's going to be mild and not the very severe, complicated type of chickenpox vaccine. All right. So thank you so much for listening to me for the past. For those who are just joining, I just want to recap. I've been talking about chickenpox, also known as varicella zoster. It is caused by a virus, with varicella virus, and it is a very highly contagious disease. And like most of other viral exotem, it starts with a fever and maybe a little bit of tiredness, poor appetite, and eventually you have the very distinct rashes that we see in chickenpox, and these rashes tend to be itchy, it tends to be blister-like, and it tends to start from the chest area and the back, and then before it will spread to the rest of the body. And it's a very highly contagious disease. So most people who are around somebody who has chickenpox, who has not been immunized or who has not had chickenpox by themselves, are going to get chickenpox, okay, 90% of the time. And even most of the time before the person start having rashes, they are already contagious. So you have been exposed to it already. And in most elder people, chickenpox just run about for 4 to 7 days, and all the rashes will clear and they'll be fine. But in certain category of people, the infant, the pregnant women, people who are immunocompromised, either from HIV/AIDS, from cancer, from having a transplant, for being on immunosuppressive medication or steroids, those category of people can have very, very severe form of chickenpox, and they are the ones that are likely to die from chickenpox, and those are the ones that need to go to the hospital. And then we've talked about the treatment for chickenpox is just what we call symptomatic. In other words, you treat the symptoms, you don't need any specific drugs. So usually we give paracetamol. Please do not give aspirin, do not give ibuprofen, just give paracetamol, and you can apply calamine lotion on the skin to soothe the itching. You keep the fingernails shut so that it will reduce the scratching and all that. And of course, let them drink a lot of water so that they will keep hydrated. Most people within 1 week will recover. Of course, it goes without saying that you need to keep them away from school so that they don't get to spread it to their peers as well. And of course, for those who have the complicated kind of chickenpox, you have to take them to the hospital, and then they'll be able to give them antiviral drugs, and that hopefully will help them so that they will not die. And finally, I've mentioned the fact that chickenpox is preventable. It's a vaccine preventable condition, so we have vaccines for it. Unfortunately, in Nigeria, it is not yet part of the national program on immunization birth. It is readily available in most of our hospitals, even the government hospitals. If you tell them I want the chickenpox vaccine, they can arrange for the company that produces it to bring it for you. You pay for it, and they will be able to help you to administer it. And it's usually given around between the age of 1 to 2 years, and I think it's about 2 doses that you can give to your children, and then they'll be protected against chickenpox. So that is it on chickenpox. If you have any questions on chickenpox or the chickenpox vaccine, feel free to send your questions either to me via email, Dr Gbemisola at askthepediatricians.com or askthepediatricians@gmail.com, or better still, just go to our Ask the Pediatrician Facebook group. You cannot miss our group on Facebook, and you can post your questions there, and myself and my colleagues, other doctors and professionals, and our moderators will able to answer those questions within 40 to 72 hours. We'll be able to give you an answer, and so feel free to post your questions to us. And like we said, as we're rounding up for the year, if you have any topic that you would like us to talk about on this platform, you are welcome to also send the questions to those platforms as well, or better say, just send us an email, askthepediatricians@gmail.com. And for those of you on Fresh Waves Radio, you can also send it to the Fresh Waves Radio WhatsApp number or platform, and it will get to us. So next week I will still come again, and I will talk about another of the vaccine preventable conditions. And the good news is that for vaccine preventable diseases, there's no reason why our children should have this condition, because once we give them the vaccine, then they'll be fine and they will be protected. I want to encourage us to ensure that we get our children immunized. I want to remind us about the HPV vaccine that is now available for our girls to protect them against cervical cancer. If you missed the podcast on HPV and cervical cancer, please, you need to go listen to it. But more importantly, you can go to your health center now and ensure that all your girls from the ages of 9 to 14 are given the HPV vaccine. That will protect them against HPV infection, which is the cause, or in 95% of cases, of cervical cancer. But remember, your children can be protected against it. So the government is making so much effort to make sure that all these vaccines are available to us. All we need to do is to take our children and our wards to the appropriate health centers, and to make sure that we get our children immunized, so that our children will not die from conditions that are preventable. And that is our main focus, our vision on Ask the Pediatricians Foundation. We want to make sure you have all this information, all this knowledge about what to do and how to protect your children against all these conditions that they don't need to have at all, just simply by taking them for their immunization. So I hope if you have a child who has not been fully immunized, you will do the needful today and take them for the immunization. So thank you so much for joining me today, and I will see you again same time next week, same platform, where we'll be talking again about another vaccine preventable disease. And remember that all the past topics that we've discussed, you can go get them. You can watch them on our Facebook pages or Fresh Waves Radio Facebook page. You can check out my podcast, Ask Dr. Gbemi ATP Podcast. You can also check out our YouTube channel, ATP TV. You can watch all the past episodes, and I'm sure you're going to learn quite a lot from them. So thank you so much. Have a wonderful day, and keep our children safe by making sure that they are all protected against all these vaccines preventable diseases by taking them for the immunization. Have a wonderful day, and it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.